really want to thank, all of our participating sites for all your incredible efforts recently. Recruitment has really seen a boost this year, and we're really thankful to everyone for all your hard work. We have 18 sites now open to recruitment. So last month we opened Royal Stoke Hospital, Belfast City Hospital, and Royal Victoria, Belfast. So we just want to welcome all of those trial teams also on board to the SepTiC study. And also well done to Scunthorpe General Hospital, Royal Stoke Hospital, and both the Belfast hospitals for recruiting their first patient to the SepTiC trial. We also just wanted to let everybody know, for anybody who's joined on a site that's not currently part of the SepTiC trial, we are still accepting expressions of interest from sites. So please do get in touch if your site are interested in taking part in the SepTiC study, and we can send you a feasibility form to complete. So I'll just pass over now to Anna from Kettering General Hospital, who's kindly going to present a few slides. Thanks, Anna.
Okay, thank you very much. Good afternoon to each and every one of you. Um, my name is Anna, and then we are two nurses helping out on the Kettering General Hospital. Our PI is Dr. Denise Sundaran, and the sub PI is Dr. Jetli. Next slide, please. So, what are we and what we do? So, our ITU is a 14 bedded, and we do have two additional dialysis rooms, and we are staffed at 10 patients at any time. So, as I've said, myself and Natalie are the two research nurses are running um, the study, and then so most of the time we split our schedule. Um, Natalie usually start in the morning, like 7 o'clock, just to be with the nurses handover and doctors handover, just to identify quite easily if there's any potential patient, and then if and of course for um, awareness as well. So it's much better that they see us nurses, research nurses, that we are very active in screening and recruiting as well. So we created this kind of a QR code. Um, as you can see, and we put our bleep on it. This is specifically used for our staff, ICU staff, and for doctors, especially the new doctors, because we tend to do some induction training as well for doctors, most especially. So it gives them like an overview of what's the study all about. Next slide, please. So, like I've said earlier on, so we're splitting the time to go to ICU, one in the morning more often, and then one in the afternoon, so that we're not really missing a patients. And then we um, make sure that we've given our information, our bleep, our phone numbers, and like I mentioned earlier on, we are very visible um, in the ward rounds and handovers in the morning, and encourage us as well to um, for the nurses to, once they see us, they're gonna think our patient will be suitable, I think, for one of the research study. So we created those packet size for easy access for the doctors and nurses, and then those QR codes is very visible as well in the nurses station. So, and like I've mentioned, we attend the induction meeting, we attend the nurses meeting just to keep them, so everything that has been like, for instance, now we kind of attended a meeting, so every information we pass it on to the teams just for them to give them an update of what's going on to the study. Next slide, please. So like I've mentioned, we're very engaging with our doctors and nurses, so we created like a referral QR code referral. So this will guided our doctors and nurses once they see the patient admitted. If As you can see all our studies, if you can able to scan it, you can have an overview of what um, all our studies are, and then it will going to at the end of the referrals, it will gonna say if the patient is eligible or not. So that QR code with the research referrals, it has all the studies with all the inclusion and exclusion of the study, active study we are doing at the moment. And next slide, please. So upon we have this game in our unit. So those who have um, top, not, I should say, not top recruiters, but top referee people, we kind of motivate them that we give them some certificates. And from the last recruitment, I there's one of our registrar, I think, recruited like 3 patients every week. So we've kind of give them some incentives like gifts. And of course, we created our monthly newsletter as well. So once we've given some gifts to the person who recruited or randomized, we kind of upload a picture of them, and just to lift their hard work of identifying patients, recruiting for us. So those are the little things that we do here in Kettering. And that's all, I think. I hope it's that it will going to help out with the other sites as well.
Sana, that was really helpful. Just want to pause here and check if anyone's got any questions for Anna or anything for that part of the study. Oh, Tony.
Anna, first of all, thank you for sharing that information. I really enjoyed hearing about it. I like the idea of the think cards. If I've understood it, these are just little pocket-sized cards with the inclusion exclusion criteria. Is that what they were?
Yes, yes. So basically, we kind of get into your website, and then we just um, get that information about the exclude. That's primarily used for the medical team, the just for them to, because it's easy access for them. If you get a QR code, then they can easily read what is the exclusion and exclusion, inclusion and
Yeah.
exclusion.
No, so actually the QR code is quite nice. I did click on the follow the QR code and I saw, yeah, it takes it to the inclusion exclusion
Yeah.
slide. So that's a neat way of doing it. And
Yeah, because we really wanted to make life as easy as possible to the ICU staff, because they're busy unit already. So as much as possible, less things for them to do,
Yeah.
but we can help each other about, help each other. That's what we wanted to um implies to the nursing and doctors as well, just
Yeah, and
to
the
commute.
forms thing as well. I again had a quick look at that when with the forms, the idea of flagging up if you've got a patient with sepsis,
Yeah.
you just put it up, do a bit of, it's almost like a pre-screening thing.
Yes.
I think
Yes.
I'm definitely going to implement this as a way of people
Yeah.
notifying other members of the team, because presumably it sends you an email to say there's a potential septic patient coming.
Yes,
Like
exactly.
a,
Because it's very handy as well during out of hours
yeah,
and weekends, because research team is always Monday to Friday. And then at least our screening log is very active, even though we miss the patient, but still we updated in our screening log.
yeah, that's a ideal thing. And obviously we're talking about septic now, but I know you had other studies linked in.
Yeah,
I mean,
yeah,
we
yeah.
want to support critical care research in general, so I think that's a great way of flagging for potential patients for with new admissions. I really like that idea. It's a neat thing. So thank you so much for sharing. It's very helpful.
Pleasure. Thank you.
Thanks.
Tony, if I may, in Oxford we have a QR code to a WhatsApp group for the study, so they can notify us straight away. Same kind of thing, but that's for a WhatsApp group.
Can you see this is why we shared. Can you make a form that goes to a WhatsApp group rather than an email?
No, so on our study poster, we would put a QR code to a WhatsApp group,
Oh, okay, got you.
and they can just join it and then let us know.
Got you. I see what you're saying. Yep.
Some good ideas. Does anyone have any other questions or queries for Anna?
I think there's a question in the chat.
Oh, yes.
Couple.
I think they might be more study specific. So, one from Phil Hopkins, I think it's a question for Tony. Can I check that the two lymphocyte counts within 12 hours, do they both have to be after admission to critical care? So this is the additional eligibility criteria for the GMCSF intervention.
No, Phil, the they don't have to be taken in the ICU. So the time limit, the one before inclusion, it doesn't matter where it was taken. So it could have been done on the ward before they were admitted to the ICU, because we do allow that one. And while we've been talking, I was trying to bring up the protocol to remind me of the time window. It's allowed, but maybe the team will remind me what the time window. The time window is the only bit that matters. It doesn't matter where the sample was taken. You might not even know that. That was be my one point. And it's about the lymphocyte count being low, and sustained low is what's important. So that's why we're happy to take one pre-randomization. Oh, sorry, pre-ICU admission, and then that second one. So it's got to be on 2 consecutive days. So it could have been the day before.
Thanks.
And then second question about consent. If a family next of kin do not have capacity to provide consent due to a few issues listed, can we use nominated professional consent?
Yeah, and I think that's okay. I'll look to the team to make sure that I don't break any regulatory rules. But I think if it's documented, importantly, you document why you felt it was inappropriate to speak to the next of kin, and therefore you do professional legal representative. That's okay. I think importantly that particularly in that acute situation where there is that stress over the initial admission, that may be acceptable. I think hopefully over a little bit of time, if stress levels have come down a little bit, it's important that the family know about it. So then talk to them when the situation has improved, shall we say, so to allow that better communication.
Thanks, Tony. So Anna might have to leave the call soon, but if you have any other questions, please let us know. And thank you again, Anna, for sharing your insight and some really great ideas on how you sharing information around the team. We're quite keen to hear from other site teams and have others present as well in our webinars. So, if your site or site team are keen to present, please do get in touch and let us know. So for the remaining slides, they're just a few study updates. So just based on some recent queries that we've had, and our team will just go through a few recent updates. So I'll pass over to my colleague Paulina, who will just go through a bit of a refresher about randomizing on OpenClinica.
Thanks, Ravi. If you just want to press the next slide. So here we just have a recording of the randomization confirmation and assignment form for GMCSF, but this also applies to the diagnostic and the fluid randomization on OpenClinica. So what you would first do is obviously do the randomization confirmation page, and as you can see, the patient information has been pulled from previous forms. The treatment allocation for randomization 1 and 2 has also been pulled, and the source of infection. So you would then confirm that the patient is eligible for this randomization, confirm the randomization date, and press randomize. You will then be prompted to confirm the completion of the form. You will click confirm, and your natural instinct is to go straight into the assignment form. But what we would ask you to do is just to hold on for a couple minutes, a couple seconds even, not minutes, just until the system has updated. So as you can see here, the system has updated the form. The top right-hand corner has changed from white to orange, and you can now enter the assignment form. And you can see that the treatment, so the kit code, has been pulled from the confirmation form. So the randomization has been completed appropriately, and you can then pull that kit from the fridge, or you'll get to see standard care or PCR diagnostic if you're doing the other interventions. So this is an error that pops up quite often. So this is another screen recording of when the allocation hasn't pulled through. So you would go again into the randomization confirmation form and do the exact same thing, confirm that the patient is eligible, confirm the date of randomization, press the randomize button, and complete the form. And then normally some people enter the form a little bit too early. So you can see here that the randomization allocation has not populated. So what we would ask you to do then is not to panic. You can close the form. And we would then ask you to enter the form using the 3 dots and the edit function. You can see now the system has been able to update the form and the kit has been allocated. So if there's ever a moment that the treatment box is empty, please enter the form using the 3 dots and edit function. This will then pull the result for you. So I think the next slide, this is just a couple of reminders from the randomization guide that after completing the confirmation page, please wait for the system to show the assignment form has been updated. So it's the top right-hand corner has to turn from white to orange, and you can see at the bottom it says in very small writing system. Then open the form to view the assignment. If the assignment is blank, you should close the form, not complete it, wait for a moment and reopen using the edit mode. So OpenClinica has informed us that if this does not work, do not try again. You may need to clear both forms and try randomizing again, but you can drop SepTiC an email or give us a call and we will guide you through this. And please do not try to manually delete any data. We also have loads of guides on our website, and a YouTube video explaining how to randomize and what to do if there's any issues. And then this is just another reminder about correctly labeling samples. So in our sample manual, we have a very detailed explanation of what labels go on what tubes. So once your patient is randomized, if you just grab their kit plastic bag with all their labels in it, identify the white tube labels, and these all have so I can see that Dorota has asked if the slides will be emailed. Yeah, we're recording and we'll share the slides after. But you will just grab the white tube labels, and these all have a very specific barcode, and the last letter at the end of the barcode signifies what label this should be attached to. So if you just follow the sample manual, you can attach the correct label to the right tube. And after you have done this, you can complete the sample shipping form and attach the colored labels to the correct sample name and fill in the rest of the form, and make sure to add this into your shipping box when you're shipping out the samples.
Thanks, Paulina. I'll just pause again and see if there's any questions about any of the randomization process or any of the sample collection shipping process. Okay. So we'll just move on to site setup and training documents. Again, these have been presented at previous webinars, but we just thought for all our new sites, it'd be helpful to do a little bit of a refresher. So we had a few questions about some of the training requirements for the trial. So we've got this table. In some of the examples, you may not have, you know, a site staff member who meets this exact example, but we've tried to include some of the clinical team members who'd be taking part on the study. And for most site members, we would expect for them to be on the delegation log, especially, you know, the PI, any investigators, research nurses, and we would require their GCP and CV, and also for them to complete the site staff training log. And then for Open Clinica access, it depends on what the user role would be on Open Clinica. So for a PI, there is a specific PI training and access. For all other staff, there is either data entry access, which will give you access to randomize and enter data on the system. And also there is a randomization only training that's just for additional site staff who you would want to help out with only randomizing. We have some additional training which can sometimes be confused with some of the main training. So these additional training requirements have been generated in response to site queries, and this is for site members or, sorry, team members who would be helping out with very specific roles. So if you have somebody, you know, say it's an evening and a weekend, and you need assistance with an IMP prescriber, there is a shortened training log and a shortened set of training slides for which somebody who prescribes as part of their day-to-day role can complete that training and that log and then prescribe for the study. Similarly, for the IMP administration, on our FAQs on our website, we say that bedside nurses can administer the IMP. And for this, we have a shortened training set of slides and a training log in which multiple site staff members can sign. For the trial, assessing eligibility must be done by a clinician, which the MHRA states must be a medical doctor. If it's a doctor that's already on the delegation log and delegated this role, that's fine. If you'd like to add additional clinicians who will only be assessing eligibility, then they will just need to be delegated that role and complete a shortened training log. for assessing eligibility. And same with randomization. For people who are just randomizing patients on the database, there is a shortened training role. But as this slide states, these accesses and roles are limited, and whereas the access given on the previous page is more of a full access. We're just going through some of the eligibility documentation. So again, for doctors added to the log who are only assessing eligibility and not completing any other trial-related tasks, they can be added to the delegation log, and we wouldn't need their CV or GCP. We would just need them to, number one, review these confirming eligibility training slides, be added to the delegation log, and ensure the role C is added, then complete the training log. And for all patients, the SepTiC eligibility form must be completed. So for this trial, assessing eligibility must be a medical doctor. The MHRA does not allow for ACCPs or matrons to assess eligibility. I'll now pass over to my colleague Promi to give another update about our Florence system.
Thanks, Ravi. So SepTiC is moving to an electronic site filing system, which we have informed sites over the past couple of months. Just to reiterate, we will be using Florence going forward. Florence electronic site files have started being rolled out at participating sites, and we are onboarding our first couple of sites over the next few weeks. We will be contacting sites separately to initiate the transition into Florence and starting the Florence training. So do not panic. We will reach out individually to each site regarding this. And in the interim, especially to the sites that are currently open, we please advise you to continue using and maintaining the physical ISFs. So some of the benefits of Florence. So we've realized that there is reduced printing. There is the opportunity for electronic signatures, which should streamline the process for signing documents. It saves space and time, and there's easier communication between the sponsor team and the sites regarding study documentation. The next slide, please, Ravi. Thank you. So Florence has 3 sets of training modules. So the first one is investigator, and this is for the site PI, co-PIs, and APIs, or any other investigators. The second one is the site administrator. So this is essentially for the site staff who will be managing and maintaining the EISF. And we ask each site to provide us with a primary site administrator and a backup site administrator. Reason being is because the site administrator will be able to request accesses for the remaining site staff members. And the third training is the site staff. So this is for all other site staffs who will need access to the EISF. Again, we will be reaching out to sites with more information about the relevant trainings and what's required before you are transitioning into Florence. But essentially, in a nutshell, we require one primary site administrator whom we will give access to, and this primary site administrator will be able to give access to all the other staff, including the backup site admin, the investigator, and the site staff. But if you do have any questions regarding Florence, please do not hesitate to get in touch with us. Next slide, please. Thank you. As we are progressing in the trial, we are seeing more day 180 follow-up visits being completed. And one of the queries we've recently had is regarding the mock-up blind assessment and the rationale behind it. So based on previous studies and feedback we've had from patients, we've seen that it is important in sepsis studies to look at survival, but also assess a participant's long-term outcomes, such as cognitive development. Many patients after an ICU stay can have long-term effects. So we want to evaluate their quality of survival. Cognitive decline post-critical illness is well defined, and our study is assessing whether our 3 interventions improve this. I think the next couple of slides I'm going to hand over back to Ravi just to go over the resources that we have for the SepTiC trial.
Right, thanks, Romy. So just a reminder that we have an ever-growing list of FAQs on our website. So if you ever go on the SepTiC website, at the top, there's a tab that says FAQs, and they're separated into the different interventions. So we've got a general section about diagnostic, fluid, and GMCSF intervention. So if you have a question, we'd recommend going there as a first point of call. You can search through the page, and if there's any FAQs or any questions that you have that aren't on the website, please do get in touch, and then we usually pop it on the website afterwards. We also just wanted to provide a reminder for some of our, newer sites that all of our documentation can be found on the SepTiC website. We also record these webinars. We're recording this one, and we'll upload the recording onto both our website under training videos, and also it's uploaded to our YouTube channel, so Critical Care Trials at Imperial. And all of our videos are uploaded onto there. We've got videos on randomizing on Open Clinica, collecting samples. If you have any suggestions or recommendations for a process that might need a video for, please do let us know. And then we'll just open the floor out to any questions.